Hey everybody, my name's Travis Govey. If you're turning 65 soon, approaching retirement, or just starting to research Medicare, then you're in the right place. One of the biggest things I hear from people getting started with Medicare is I don't even know where to begin. In today's video, we're gonna break down the basics of Medicare, how the different parts work, what timelines you need to be aware of, and some common mistakes to avoid when getting started. Let's jump in. So first, we're actually going to cover what is Medicare and what is it designed for, who qualifies, and when do most people become eligible. So the first thing is the most common scenario is when people age into Medicare, and that is when you turn 65. That's the most common way to become eligible for Medicare. Another common way is through Social Security disability income. So if you become permanently disabled through Social Security, when you draw benefits for 24 months, so that is 2 years, you then qualify for Medicare Parts A and Parts B. The other things that can help you qualify for Medicare is if you do have end-stage renal disease, or ALS, and other chronic conditions. So those are gonna be the ways to actually qualify for Medicare. So Medicare is your federal health insurance that you pay into your entire life. So when you get to that age, or if one of these things happen to you, you are now entitled to those Medicare benefits. So let's break down Medicare. The first part of Medicare is Part A. This is going to be the first thing that you see or hear about when you talk about Medicare. So what is Part A? The first part is this is the free part of Medicare when you start your insurance. So really that does not cost you anything. It's $0 per month. And this is what you pay into your entire life. So when you go and pay into Social Security, you're actually paying into the Medicare program as well. And as long as you've reached 10 years or 40 quarters, then Medicare Part A will not cost you anything. So what does Part A actually cover? This is your hospital insurance. When you receive your red, white, and blue Medicare card, Part A is going to say hospital on it. You're gonna have your a date on there. Most commonly, that's going to be the month of your 65th birthday. For example, I always like to use an example. My birthday is September 12th. If I started my Medicare, my Part A date would be 0901, okay? So important to understand that. So hospital coverage, what does that really mean? So this would cover you when you are inpatient in a hospital. There is a big hospital deductible, and this year it's just over $1,700, $1,736, and this does restart every benefit period. So you could pay that hospital deductible multiple times throughout the year. So that is a huge exposure when it comes to Part A, but that helps with hospital stays. What else is covered under Part A? Okay, again, Part A right there, very common, and I'm gonna write just abbreviated here, SNF, that stands for skilled nursing facilities. So you have very limited coverage when it comes to skilled nursing facilities. Typically the first 20 days could be covered. Days 21 through 100, you will have a copay for. And then after day 100, there is no cost. So no coverage. You are responsible for all of the costs when it comes to after day 100 in a skilled nursing facility. Part A also covers hospice, end-of-life care. No matter what plan or coverage you have, hospice, end-of-life care is always going to be covered under Part A. And then there is very limited home health care coverage, very, very limited. And when I say limited, to get any kind of home health care services, you have to be considered homebound. It has to be doctor's orders. And then even if those two things happen, you have to get it from a Medicare approved home health care agency, which can be very, very tough. And then assuming you check all of those boxes, then the coverage you get can be limited as far as it's part-time only care. Typically it only lasts for 21 days and it has to be medically necessary. So very limited coverage when it comes to skilled nursing, home health cares. And then again, I always like to just reiterate the importance of this. There is no long-term care or no assisted living facility coverage included with Medicare. And oftentimes, that is one of the biggest exposures that we see with Medicare and Medicare beneficiaries across the country. So that's just a little bit about Part A. So let's talk about the next part of Medicare is Part B. Part B, as in boy. And if Part A is inpatient, Part B is outpatient. Or when you get your Medicare card, Part B is going to be medical insurance. So think of this as anything outpatient. Now, Part A, there was no cost. With Part B, the standard premium in 2026 is $202.90. Now, this could be higher if you're a higher income household, so you have to always keep an eye out for that. But Part B, it's gonna be outpatient coverage. It is going to cost you $202.90. If you're drawing your Social Security, that's gonna come right out of your Social Security check. If you are not drawing Social Security, you actually have to pay that in a quarterly bill. So that's gonna cost you closer to about $608 and some change there. So just be aware of that. So outpatient services, what are some key things to be aware of when it comes to this? So Part A, we talked about the big hospital deductible. With Part B, there's a one-time annual deductible of $283 in 2026. So the premium, the deductible, that changes a little bit every single year. These are 2026 numbers. And then once you reach that deductible, and for those, again, what a deductible is, that is what you will be responsible for before Part B even kicks in. So once you reach that, what happens after that is there is an 80-20 split with no limit. And what that means is Medicare covers 80%, you are responsible for 20%, and there is no limit on this. So if you're watching this right now, you may have employer coverage, group coverage, you could have insurance through the marketplace. If you were to look at your card right now, you would find something that says OOP. That stands for out-of-pocket max out-of-pocket, anything like that. When I just have Part A and Part B and no other insurance, you have 20% with no limit. So those medical bills could reach an unlimited amount. And it's super important to be aware of how that works. So that's Part A, that's Part B. Those are gonna be the main parts of your Medicare. So if I have no other insurance and I have this big, if I go up, I have my big hospital deductible, I have some limitations on skilled nursing, home health care, my Part B, I have my annual deductible and my 20% with no limit. How do I fix those things? Well, the first option to really go with that is going to be a Medicare Supplement, or it's also known as Medigap. Okay, and just some key highlights and features about Medicare Supplements. Okay, with this, you're gonna have additional premium. Additional premium, I'm just gonna put a money sign for that, additional premium, but it gives you tons of flexibility, freedom, flexibility and freedom. And why do I say that? What I mean by that is you have no networks when it comes to this. So I can go see any doctor that accepts Medicare, which is 98% of doctors and hospitals in the country accept original Medicare. If you have original Medicare Part A and Part B as your primary and a Medigap as your secondary, you can go see 98% of doctors and hospitals in the country. So super flexible, gives you a lot of freedom. You don't need referrals. I'm gonna put no referrals, no prior authorizations for most services, so you don't have to go through a prior authorization process. And I don't wanna go into too much detail on that, but to really simplify this, you're gonna pay an additional premium and it really gives you so much flexibility, freedom, You can go see 98% of doctors and hospitals, no referrals, no prior authorizations, and it is very, very comprehensive coverage. Okay, so that's my first option to cover that up. My second option is what's called Medicare Advantage Prescription Drug Plan, also known as Part C. What this is a private insurance company comes in and they combine your Part A, your Part B, and your Part D in most scenarios. They mash it all together and they call this Part C. Okay, so it's super important to understand how this works. This is a private insurance company managing your Medicare. So they come in, again, I always like to give a visualization of this. So private insurance company comes in, they combine your Part A, your Part B, your Part D, they mash it all together, they call it Part C. So now I have a managed care plan from a private insurance company. So what does that mean for you and your insurance? The first thing is you're going to have lower premiums, okay? Lower premiums. But if you remember back to the Medigap, you had no networks, no referrals, no prior authorizations, where with Medicare Advantage, I have networks. So there's HMOs, PPOs, okay? HMO versus PPO are the most common. There's a few other network types out there, but HMO versus PPO. Then you have prior authorizations required for major services. So if you needed a surgery, physical therapy, MRIs, CAT scans, more major services require prior authorizations. Okay, so I have lower premiums, networks, prior authorizations, and then I do get some extra benefits. So some very common extras could be dental, vision, hearing, fitness benefits, over-the-counter benefits, okay? And again, to really sum this one up, I'm gonna have, again, a managed care plan, lower monthly premiums, but I do have networks, I have prior authorizations, I do get some additional benefits, dental, vision, hearing, gym benefits, over-the-counter, but you will have more out-of-pocket OOP expenses. You have co-pays, co-insurance, some additional exposures that you may not have with Medicare and a supplement, but you do have a maximum out-of-pocket, so that's the most you could be billed in a calendar year. So again, there's pros and cons to each option there. So to add to this, if you had A and B, a Medicare Supplement, then you would also need a prescription drug plan, or that is also known as Part D. Okay? Most have a premium. Okay, so Part D, again, I'm going to use the $ for that. For Part D, again, this is prescription drug coverage. Again, this is unique. A lot of people don't know this, but when you have Part D or drug coverage with Medicare, no matter what, this comes from a private insurance company. Okay, so just like with Medicare Advantage, you will need prior authorizations for major prescriptions, and there are utilization management procedures that companies use. Utilization management for things like prior authorizations, step therapy. There could be things like formulary exceptions, all super important on how prescription drug plans work. But the biggest thing, all drug plans work a little bit differently. There's different tiers for prescriptions, generics, non-preferred, brand name, specialty tier. Every prescription could be a little bit different on different drug plans. There's multiple options in every area. And it's super important to compare costs, prices, pharmacies, formularies with every single plan that's available. Okay, so that's just a little bit about what your options are for Part A, Part B. We talked a little bit about Medicare supplements to cover up your 20%, a little bit about Medicare Advantage, how do drug plans work, Hopefully this video helped simplify Medicare and gave you a better understanding of where to start. Medicare can feel overwhelming at first, but once you understand the basics, the decision ahead becomes much easier. If you found this video helpful, make sure to like the video, subscribe to the channel, and leave any Medicare questions you have down in the comments below. We'd love to answer them in a future video. If you'd like more personalized help, we've included links in the description below where you can schedule a free one-on-one consultation with one of our Medicare specialists and download a free copy of our Medicare and Retirement Planning Guide 64+. Thanks so much for watching, and we'll see you in the next video.